the Shaykh mentioned that healthy people should be fasting, and what would be the condition of a physician or a nurse or somebody working in the healthcare field that was worried about having weaker immunity if they were fasting. Is it permissible for them in that situation to break their fast? And Shaykh Abdullah said that there's two situations. One is if they were not if they didn't have enough energy to actually fulfill their duties, so they weren't. And he said that this is actually mentioned in the Hashia of Imam Tahtawi on Durr al-Mukhtar in the Hanafi madhab, that it is permitted in that situation to break the fast, but only on the day that they're actually working. It wouldn't be on the other days. And so the same is true if the doctor felt, or the nurse, that they were going to be in a compromised situation dealing with these. They could break their fast and fast later, and that would be determined obviously by the doctor's own medical judgment on that. So he said then also, that, and the reason for the obligation is clear because there's no clarification after God's clarification, and Allah subhanahu wa ta'ala says in the Quran that the fasting has been prescribed for you, that it's an obligation. Kutiba alaykum as-siyam, and kutiba here means it's an obligation for you to fulfill it. And then he said that people should not allow for their religious emotions to dictate their actions. And he said that he's not faulting them for those emotions, because those emotions come out of their religiosity and very often out of their piety. And so they're not negative instincts. But he said we really can't allow our religious emotions to override the reasonableness of our religion. And so that's very important, that we should be following the guidelines of the experts. This is the religious tradition. This is our tradition. So government and the immunologists, the guidelines that they set forth are very important to follow. And finally, Shaykh said that it's very important to make dua